Hello, everyone. Thank you so much for tuning in. Jonathan Shinkle here, owner and principal agent of Health Horizons Medicare Solutions. Glad to have you with us, and just want to say a big thank you from Johanna and I to all of our current clients who are watching. We appreciate you working with us over the years. We're so grateful for your business. Hopefully you appreciate our expertise and our advice, and we're always happy to work with you and look forward to many more years to come. So thank you for that. As always, no cost to work with us whatsoever. You're welcome to recommend us to friends or family if there's anybody that we could help or assist, especially this year as there's lots of changes with the plans that are available and plans that your family members, friends, or neighbors may have. May be changing dramatically or may not even be available anymore. So please recommend us. We're always happy to assist. And we're going to have lots of events here on the event page of our website. You'll notice that we have some daily online live webinars coming up, as well as some in-person events around the area that we would love to have you, buy you a cup of coffee or an ice cream, catch up, and help you navigate what to do for 2025 for this next year. So this update video is about 2025 updates, what is changing with Medicare, what's going on, and what does this Inflation Reduction Act mean? How is this impacting and becoming the main driver of the changes, radical changes? Some say that the biggest changes in the last 20 years of the Medicare program are happening now, 2025, due to this Inflation Reduction Act being implemented and affecting specifically the Part D Medicare prescription drug coverage aspect of Medicare. We're going to get right into it. I'm going to put timestamps down below. So if you want to skip ahead or go back and rewatch a particular section, hopefully that will be helpful. Who does this affect? It's anybody with Medicare and specifically Part D prescription drug insurance. So whether you have a freestanding Medicare Part D plan in addition to your Medicare supplement policy, or if you have a Medicare Advantage plan with Part D prescription drug coverage, this is going to affect you. If you have TRICARE for life, if you use the VA, you're a retired federal employee and have the FEP Blue, or an employer retirement plan, the implementation of this law is not going to affect you as directly. But for everyone else, here we go. So what's going on? What is this changes that are happening? First of all, what is the Inflation Reduction Act? The Inflation Reduction Act, in one sentence, is a piece of legislation back in 2022 that the government instituted to try to combat rapidly rising inflation post the COVID-19 pandemic, and specifically several vulnerable communities, those who are low income and have state Medicaid assistance, and those who have the Medicare health insurance program were most impacted by this law in regards to their health insurance. So what the government was doing was trying to tamper down on inflation. It's up to you to decide if that worked or not. Won't wade into it too politically, but for what it's worth, this is radically changing Medicare. You may have already experienced back in 2023 and then now 2024 the $35 cap on insulin per month. This is not speaking of non-insulin pens like Trulicity or Ozempic. This is related to actually true insulin. There was a cap that was instituted, $35 per month. It did help out a lot of people. We're grateful to see that. If you take insulin, maybe that's helped you. However, the biggest changes are yet to come, and they will be instituted in 2025. So all year, plans have been preparing to implement these new regulations of what the government has done, along with Medicare's annual final ruling on regulations for the next upcoming plan year. So in plain English, what does that mean? Well, the government is the one driving the bus. They're the ones who impact what plans can offer, how plans have to be structured, and how much money in reimbursements they are going to pay to these plans. So this is going to impact Medicare beneficiaries in several ways, ultimately, and the main point of this is that it's supposed to save you money. Supposed to. So Medicare Part D plans are becoming much more, I'm trying to think of the best way to say this. Essentially, we'll back up a little bit. This year, the way that Medicare drug coverage works is you have 4 stages of coverage. You have a deductible that you may pay first, the first amount that you pay 100% until your insurance kicks in. Second phase, you pay your copay. If you have a copay under whatever tier level your different drugs fall, determines the copay that you pay. If you reach a certain amount out of pocket, it was about $4,000, then you get bumped to the donut hole, which is the coverage gap, where you have to begin paying 25% of the cost. Many may already be familiar with this. If you take a brand name drug, common ones like Eliquis, Ozempic, Trulicity, as I already mentioned, you would always get into the donut hole where you'd have to start paying, on a drug like Ozempic that's $1,200, 25%, is a lot of money. The goal of the government is to get rid of this donut hole, try to help Medicare beneficiaries out, because after the donut hole, you would hit the cap of $8,000. That was your out-of-pocket limit. Starting 2025, that $8,000 is reduced all the way to $2,000. That is the new out-of-pocket limit on every Medicare plan, and that cost essentially is being passed from Medicare beneficiaries back to the drug manufacturers and to the insurance companies. And so it's going to raise cost for manufacturers. It's going to dramatically affect insurance companies, but it will ultimately reduce your out-of-pocket expense as a Medicare member. Now, if you don't only take generic drugs or you don't take any medicine at all, the way that it's going to affect you is your plan, your insurance company, no matter what company it is going to have to make up this cost somewhere. So plans are going to change rather dramatically for 2025. Now, in addition to this, we have the expansion of the Extra Help program. So the Extra Help with Part D, or known as LIS, Low Income Subsidy, that was expanded. It's an assistance program that is meant to pay the vast majority of costs that the patient would normally be responsible under Medicare Part D. And so if you take a brand name drug, maybe that's $45 copay, and then you would hit the donut hole, eventually you have to pay a couple $100. You may only pay $10 a month at most the entire year if you have Extra Help. Generic drugs would be even less than that. The new limit is 150% of the federal poverty level. So if you think that you may qualify for Extra Help and you're not currently receiving it, I would encourage you to apply. It's free to apply. Worst they can do is say no. Now, in addition to this, there's some ways that this new legislation is impacting beneficiaries, like I talked about, the removal of the donut hole, the $2,000 cap. But probably most important for you to understand is the prescription payment plan that will be available starting in January of 2025. Now, because the industry expects deductibles and copays on medicine to go up fairly dramatically due to this increased cost that insurance companies have to absorb, there is part of this legislation called the payment plan, or they call it smoothing, where it kind of is meant to smooth out throughout the year the cost of medications, make it even throughout the year. So kind of an interesting name, smoothing, not too hard to remember. But essentially what this means, is I'll give you an example. Say you take a brand name prescription drug and it's $1,000, and your plan has a $500 deductible at the start of the year. That means in January, you have to pay $500 before your insurance pays anything. And then after that, you have to pay whatever your copay is. So let's see, your copay is, $300 for a 90-day supply. So normally every 3 months you would pay $300 to get a 90-day supply of that medicine. Well, $300 plus your $500 deductible is $800. And the first week of January, having to pay $800 at the pharmacy counter is a big shock. So what they did is they created a way to smooth that expected cost out evenly over all 12 months. And so this is something that you have to proactively enroll in with your current insurance company. You're not automatically enrolled, but this will help a lot of people out at the pharmacy counter in January to be able to spread that expected cost out evenly throughout the entire year. So be sure to look into that. And as the companies publish how to enroll in that, we will try to make that as easy as possible for you, whether it's a form, whether it's an online sort of opt-in process, or by phone with the insurance companies. We want to be sure to let you know. All right, what's next? So this is obviously going to impact the bottom line for the insurance companies, and we all know that the insurance companies are not just here to be a good neighbor. They're in this business to make money. And CEOs for these companies have been telling investors all year on their earnings calls that the Medicare landscape is shifting, that things are getting squeezed for each of these companies, and that they're going to have to reduce their membership and increase costs in order to remain profitable. Part of what's playing into this as well is increased utilization. Post the COVID-19 pandemic, more and more people are going back to the doctor, getting routine tests and screenings, getting treatment that maybe they put off or didn't get done. Some things are $0 copay, that are preventative screenings like a colonoscopy or cancer test, but that translates to increased cost back onto the insurance company. And more people doing that at the same time obviously puts pressure on them to pay those claims. In addition to that, the way that Medicare Advantage works is through reimbursement to the insurance companies. If you have a $0 per month Medicare Advantage plan, it doesn't cost $0. Money's coming from somewhere, and where it's coming from is Medicare is paying those insurance companies to give you your health insurance every month. It's a flat rate per month that they're paying them, and the insurance company has to budget and make that work for all of its members. Now, Medicare typically has increased those payments every year to the insurance companies historically. However, in the last couple of years, those payments have gone stagnant and been decreased. And so in addition to the companies this year having to absorb a massive amount of increased costs, just think about everybody going from $8,000 down to $2,000 that takes very expensive medicine. That is a lot of cost for these insurance companies to absorb, and the government is not helping them out. They're actually effectively reducing, having to work on even tighter of a margin. And so of course, the insurance companies could pay their CEOs a lot less. Of course, they could get rid of fluff. But what they're going to do is ultimately pass that cost back on to you as the consumer. And so what we expect to see is insurance companies, what can they do? Well, they can raise deductibles. So if your plan has no deductible for medications, or if it's, just $100 or something like that, we may see, deductibles of $300, $400, $500, especially for those brand name drugs. Not necessarily the generics, but any brand name drugs, you may have to pay $300, $400, $500 deductible before the insurance pays anything. Second, there's things like copays and coinsurance that the insurance companies can raise, and they can reduce extra benefits, things like the dental, the vision, the grocery cards that have gotten so generous and so rich the last few years. We expect those ancillary benefits to be impacted, potentially the most, as well as the maximum out-of-pocket responsibility for medical. Now it's $2,000 is your cap for prescriptions, but medical is different. So they may crank that medical up quite a bit of what your ultimate responsibility could be. Now, unless you're getting chemotherapy or kidney dialysis or end-stage kidney disease, that's not going to affect you as much. Only 1.8% of people ever hit their max out-of-pocket. So if that max out-of-pocket was $4,000 this year, now it's $8,000 next year, only 2% of people hit it anyway when it was $4,000. I don't see that many more people hitting it when it goes up to $8,000. But for what it's worth, you're going to see that, and it may look like some sticker shock. Also, the last thing I'll say is, we expect there to be some shifting in the landscape of what plans are available and where they are available. And so especially these plans that were extremely generous with the dental and other kinds of free stuff that they were giving out with their plan, we expect those to be constrained a little bit. Some plans may reduce the areas that they serve. That means, you could have two counties side by side that are both covered by the same plan today, but in 2025, they're removing one of those counties from the service area. So all those people in that county are going to need to find new health insurance. That's, of course, where we come in. We are your agent, so we're here to help you, and we already have a plan in place for those that we have heard of so far that are affected. And we're going to be doing, like I said in the beginning, lots of live events, live online webinars, trying to help assist, and of course can schedule calls and meetings as well. So feel free to share that information. I tell people, please don't call the 800 numbers. I know they knock your door down with the phone calls, the mail, things like this. They want to make a quick buck signing you up. They don't know your area. They don't know the hospital systems and the specialists and things like that work with these plans networks and what the potential trade-offs are between different plans. And so please work with a local agent. If you've worked with us over the years, we so appreciate your business. We'd love to work with you again this year. And we're going to walk through each plan, hopefully in video format, where you can see what the updates are with your plan and what we may recommend for next year. And so we're really moving in that way of trying to utilize the technology that we have invested in so that we can help more and more people, as we expect people who are affected by these changes to be referring friends and family members, neighbors to us, for our expertise to help them in choosing a new plan. And so we're ready for this open enrollment period. We're excited to work with you. Like I said before, we're going to be doing some local in-person events. Come join us for a cup of coffee. Let us get you an ice cream or a cup of coffee and hang out and help to advise you on where you should go here over this next year. So stay tuned for that. Check out our updates page, and we'll have future videos coming out shortly that are plan specific. And so if you're on a Humana, you'll be able to go to that page. If you're with, Anthem, Blue Cross, or United Healthcare, whatever your insurer is, we're going to try to go through those things in detail. So thank you so much for your time. We wish you the best, and from all of our family, we wish you and your family the best. Have a great year.